Hi, my name is Kristen Mace-Wease, and I am the Chief of the Primary Care Department at Lebanon VA Medical Center. As a leader in the primary care department, it is one of my top priorities to make sure veterans have access to care at all times. Not only do we want you to have access to care, we want you to have access to care that meets your need, fits your lifestyle, and keeps you safe. I want to talk about the types of visits that are currently being offered at the medical center and how we determine what type of visit should go with what type of patient. I'm going to start on the left-hand side of the screen where it says types of visits. The first type of visit is the face-to-face encounter. This is the traditional visit that we're all used to. It's what we've been doing in healthcare for decades. I put a little note here that says, change is hard, and I want to specifically talk about why I wrote that. We know that the changes that occurred due to COVID-19 have been difficult. They've been hard for our patients, and they've been hard for our healthcare workers. As a provider myself, I can tell you, I miss seeing my patients. I miss those face-to-face encounters. But it's also my job as a clinician to make sure I'm keeping everyone safe. Now, that's not to say that face-to-face appointments are no longer available. They are available, but we are doing our best to limit exposure by reserving them for those who have no other option to care or who require a visit in order to accurately assess their healthcare need. The second type of visit I want to talk about is what we call the VVC visit, or Virtual Video Connect. This is a new approach to the same great care that you're used to. VVC visits allow you to stay home and still access your healthcare. They allow your provider to see you through video that's done right to your house. This is great for veterans who live far away, who have transportation issues, or on those occasions when we have bad weather. You can get your video visit, see your provider, get your healthcare needs, and not put yourself in harm's way. That's the best thing about VVC visits. We're able to give you care and keep you safe at the same time. There's also a variety of different options we can add on to a VVC visit, such as blood pressure cuffs that monitor your blood pressure at home, or even stethoscopes that will allow providers to listen to your heart and lungs while they're here at the medical center and you're at home. Now, I know what you're thinking. You're not tech savvy, or you're worried about doing a virtual visit. Don't be. Trust me, this has been a learning experience for everyone involved, including the healthcare workers. It's been fun, and we've had a lot of laughs. We're all in this together. One of the great things that the VA has to offer is the Virtual Video Connect team. And what they will do is, if you're unsure about the video visit, they'll reach out to you before your appointment and do a trial run with you. Make sure that you connect okay, answer all your questions, and make sure you're prepared. So that way, the day of your visit, you're already a pro. The final visit that we have is the telephone visit. Now, you'll notice this is on the bottom of the list, and you're probably wondering why. Well, as I said earlier, we miss you. We want to see your face. There's something in medicine we call the gestalt. The gestalt means the combined whole. The best way I can describe this is when you ask someone how they're feeling, and they say they're fine, but the look on their face tells you otherwise. In that situation, you're using gestalt. You're looking at the combined whole, and you're assessing the patient and saying they're not fine, even though they're telling me they're fine. We can't do that over the phone. We need to see you in order to do that. That's why Virtual Video Connect is the preferred method for telehealth, because we can physically see you. Next, I'm going to talk about how we determine which visit goes with which patient. Visits can basically be broken down into two different types: routine visits and acute visits. Routine visits are the visits that you know are coming, the 6-month follow-up, the 3-month follow-up. When COVID occurred and we had to make changes to the system quickly, all visits were automatically converted to telehealth in order to keep our veterans safe. As we move forward in the future, determining the type of visit you will have will be a shared decision between you and your healthcare provider. You will decide this before you end your prior visit, so we know how to schedule you for your next visit. For an example, your provider may say, today we did a virtual video connect visit, so in 6 months, I'd like to see you in person. Or, today I saw you in person, and in 6 months, the weather likely is going to be cold or bad, so let's set you up for a virtual video appointment so you don't have to travel. The second type of visit is the acute visit. These are the visits that occur in between your routine visits. the unexpected visits, or as some people like to call them, sick visits. In order to determine what visit type would be best for you, we need to have enough information to make a clinical decision on what would meet your care need. To do this, we have you start by talking to the nurse so they can gather more information about your situation. After speaking with the nurse, we determine the next step. If the veteran prefers to be seen for a virtual visit, we schedule. If the nurse gathers the information and determines this is not something that we can do over a virtual visit and the veteran requires to be seen for a face-to-face visit, we schedule the face-to-face appointment. Then you have the situation where we're still not sure what to do. The nurse doesn't know if we can meet the veteran's need on a virtual visit. In that situation, we schedule the veteran for a virtual visit with the provider. The provider contacts the veteran for the virtual visit, gathers the additional information needed, and then decides, can we complete this encounter on virtual visit, or do I need to see this person face-to-face at the facility? If a face-to-face appointment is needed, we schedule accordingly. So as you can see, Lebanon VA Medical Center offers a variety of different appointment types to allow you to access your healthcare in a way that fits your lifestyle, meets your care needs, and most important, keeps you safe and healthy.
Enrolled veterans may also receive care via phone call or virtual video visit by calling the Tele-Urgent Care Line. Providers are available 365 days a year from 8 a.m. to 8 p.m.